Welcome back to Exercise Science. Today we're going to be delving further into the anatomy and physiology unit, and within that unit we are going to be taking a look at bones and specifically the shoulder. Alright, within the shoulder we have three bones that comprise the actual shoulder joint itself: the clavicle, the scapula, and the humerus. But before we look closer at those, we're going to take a quick peek and include the two bones of the forearm, and that is the ulna and the radius. We'll also take a little view at the carpal bones, which are the 8 bones that form the wrist, the metacarpals, which are 5 bones that form the palm of the hand, and the phalanges, which are 14 smaller bones which form the fingers and the thumb. Moving on to the actual shoulder joint itself, the first area we're going to focus on is the clavicle. And within the clavicle, we're really going to focus on two areas: the acromial end, which is this end, and this being an anterior view. This is the end that actually articulates within the shoulder joint. And it's called the acromial end because this end articulates with an area of the scapula called the acromion. We'll talk about that in a little more detail in just a second. The other end that we're going to look at is the sternal end, and that being this side. And this is the side of the clavicle that articulates with the manubrium and the sternum, and that's all being part of the breastplate. So this actual bone itself here, if I shrink it down, I'll show you exactly where it exists on the body. This being an anterior view, I'm going to take this guy and set him right up here on the front of the shoulder. That's where that bone exists on this character. Okay, the next section we're going to focus in is the scapula, which is commonly known as your shoulder blade. And we're going to look at a number of sections on the scapula. The first one being the acromion, and that is this large wing-like structure here. And you can see that on the anterior view and on the posterior view. And that large bony area is essentially what forms the top limit of the bony shoulder joint. Next we have the coracoid process, which can really be seen best on the anterior view. And that's this large finger-like projection here, which forms the front part of the bony shoulder. And the purpose of the coracoid process is to give a strong, solid attachment point for some of the stronger muscles of the arm and muscles of the chest. The superior angle is just simply the top edge of the scapula, and you can see it on both views here, anterior and posterior. The spine is this large ridge, which you can see on the posterior view here, and the purpose of this large ridge is to give a strong, large attachment point for a lot of the broad muscles of the back. And the last two things we're going to look at are the medial margin and the lateral margin. And this being a right side view, if we look at the medial margin, we are looking at the inside part of the scapula. This being where the arm attaches, this would be the medial margin, and this is the medial margin on the anterior view. And the opposite of that would be the lateral margin, and that would be this guy here and this guy here, and these are the outside edges of the scapula. Moving on, next we have the humerus. The humerus being the large bone in the upper part of the arm. First we want to focus on the greater tubercle, and that is this large bump right here on the outside of the shoulder. And that's an easy one to feel. If you actually reach up and touch the outside of your shoulder, you can feel the greater tubercle. Again, with every long bone, there is a large area at the top, and that is referred to as the head. And that large structure allows the bones to articulate with whatever joints are in the area. Again, also with any long bone, we have the shaft. Very simple and straightforward. Medial and lateral epicondyles. Right here, the medial epicondyle, and here the lateral epicondyle, and these large bony areas at the end of the long bone allow for the attachment of ligaments, tendons, and muscle. These last three sections we have are grooves and shapes within the humerus, which allow the humerus to articulate with the bones of the forearm. We have here the olecranon fossa. And even though it's not particularly visible here in this view, what it is a significant depression within the bone, and this allows the ulna to articulate with the humerus. The trochlea is this section here, which really forms kind of a canal or a groove. And again, the ulna articulates with the humerus through this groove. It keeps the alignment proper for the elbow. And the last section we're going to look at is the capitulum, which is a rounded section right here on the lateral side of the humerus, And this section allows the humerus to articulate very easily with the radial head of the radius, which is the other bone that forms the forearm and attaches right here. Okay, you can see a lot of that on page 31. If you want to turn to that page, all of the features and bones we have looked at are very clearly visible. However, if you do want to take a look at a closer view of the attachment between the humerus and the bones of the forearm, which are the ulna and radius, you can see a much better view of that actual articulation on page 33 in your coloring books. So there you have it. You can go ahead